Hey everyone, today I want to talk about a significant issue we still encounter in modern healthcare, which is the conventional approach for knee pain. So first of all, to clarify, not all the doctors are the same. Like in any profession, there are good ones and there are bad ones. So I'm not judging everyone. But if in 2024, your doctor suggests the old approach of rest, ice, and ibuprofen for knee pain, it's time to ask yourself questions whether this approach is truly effective or not. You should never stick to one man's opinion. So all of the things these doctors or physios are telling you that you won't be able to do again, they might just be lacking the information to help you. So you just have to find somewhere else, people, professionals that have the knowledge to help you. So first of all, the question you should always ask yourself when you're working with these people is this approach optimal for healing my knee pain? You should know that resting does three things to your tendon. It leads to degradation, it compromises the tendon structure, and it weakens tendon strength. Most often when there is pain, there is inflammation or swelling. Even though you might not be able to see a marked increase in fluid to the area, there may still be swelling. Rest allows the swelling to decrease. It allows the painful stimulus to subside, and it allows any compensation patterns to diminish, and it gives your body a break. So the first couple of times when you return back to playing, it might feel good. But over time, you return to your old compensation and you start again feeling the pain you once felt, or even worse. While you rested and did nothing, the rest of your muscles began to weaken, and this has made for a more precarious situation than you were once in. Now, you're not only dealing with an injury, you're also starting to have deconditioned muscles. While short-term rest can be beneficial to calm acute symptoms, it's essential to focus on keeping active and modifying movements that aggravate the condition. It's actually very simple to work around knee pain. Let's take the leg press for example. If a complete leg press rep hurts, you can just do partial reps. If a concentric movement hurts, you can just do an isometric rep and just build your way slowly back up and progressively to your normal reps. This is with everything. Same thing with squats, same thing with leg extensions. Instead of doing full range of motions, back squats, just use some pins. The way I like to do it is just use some pins and put myself in a Zercher position and just perform partial reps. You would be surprised how heavy you can go without feeling any pain, especially if we're talking about tendon pain. So adjust your exercises, adjust your reps, adjust your tempo, very easy and very effective to progress. Research and practical experience both advocate for maintaining movement to preserve tissue function and prevent deconditioning. Let's put it into multiple steps. Step number 1, stop elastic activities. If you experience pain during any activities involving the patella store and release function, cease these activities immediately. It's always funny because it just makes sense. There's a lot of times where people come up to me, whether it's in real life or on Instagram, and they're like, Coach, I train this amount of time, I do this, I do that, and my knee hurts. The simple thing is just do less, see how you react, and just go from there. So step 1, I would say, let's say you're training 6 to 7 times a week, maybe even 2 times a day, you're playing basketball or you're playing football, volleyball, whatever, just do less of it. See how you react. Maybe going from 2 sessions a day to 1 session might help, and maybe going from 6 sessions a week to 3, and just in between there, you just incorporate some strengthening exercises might do the work as well. So at first, you would want to experience with this and just finding which is the activity that actually aggravates my knee pain. Step number 2, perform pain-free isometrics twice daily. So this can be a leg extension isometrics where you just hold the position for 30 to 45 seconds. This can be a leg press isometric. This can be a Spanish squat. So pick one exercise, 3 to 5 sets, 30 to 45 seconds every day. This is usually performed mid-range or just above because it has to be pain-free, and usually the deep knee flexion position with heavy loads. That's where you aggravate the tendon pain. Step number 3, progress back to isotonics. So the goal of this phase is to restore muscle bulk and strength while using functional ranges of movement. In terms of exercises, you can think of a split squat, you can think of a rear foot Bulgarian split squat. Keep the load quite high, so I would always go above 70 to 75% of your 1 rep max. Keep the tempo of the exercise very slow, so you don't need to move up explosively, and keep the reps low as well. Step number 4, where most of the time things go wrong, start incorporating plyometrics again. So in this phase, most of the time we go from extensive plyometrics to intensive plyometrics. And lastly, step 5, the time you've all been waiting for, return to play. One last thing I want to say about step 5, which is very important, is even the day that you go back to training with your team, day 1, don't go out and give everything you have. Apply the same rules of your rehabilitation to training with the team, gradually progressing, seeing how you feel, gain back your confidence, and from there, trust me, you can't make any mistakes and you will just go slowly back up at your normal level, or you never know, even better than that. Before we end this video, let me share with you a simple, but in my opinion, the most effective tip you can receive from a physio or personal trainer, which is keeping pain scores and a journal with you during your rehab. The way this works is very simple. So let's say it's Monday morning, you go to the gym, you train. During training, guys, it's completely fine to sometimes feel pain. I always say if it's below 5 out of 10, nothing wrong, okay? But the most important thing is to assess your pain the next day, okay? So let's say during your session on Monday, you had a 3 out of 10 pain, okay? The next day you wake up, your pain is still a 3 out of 10, or it went down to a 2 out of 10. Perfect, okay? The pain went down, that's what we want. Let's say your pain scores increases to a 4 or a 5. That's when we have to ask ourselves questions and just take our time to reflect and look back at our session. What went wrong? Was it a certain exercise? Was it a certain range during exercise? Was it maybe too much load during a certain exercise, or too many reps? Okay, and again, I will go back to the journal. That's why this is very important. Okay, during your training, just keep a journal, write down the exercise you perform, and just write down how you feel while performing the exercise. And the next day, you can just simply look back at your journal and be like, it's true that while I was doing a split squat, I think I was using a little bit too much load, and this might be the cause of the aggravated knee pain, okay? If you wouldn't have this journal, you would have to think about this, about that, which at the end of the day, maybe you wouldn't be able to look back and be like, okay, the split squat is what caused the pain, and it was the load, okay? So just keeping a journal, writing everything down, and trust me guys, I've done it myself. My clients, athletes, patients are doing it as well, whether it's for rehab or even just in general life, even with food. Just write down what you're eating, just write down how you feel after eating, write down how you feel an hour after eating, and just reflect. And at the end of the day, let's say you do this for a month, trust me guys, your diet will be on point. And this is the same with your rehab, your progressions will be on point. Thank you so much for watching, guys. If you found this video helpful, please give it a thumbs up. Don't forget to subscribe to the channel, hit the bell icon to get notified whenever I post again. And if you have any questions or topics you would like me to cover, drop a comment below, okay? Love hearing from you guys. Until next time, take care and stay active.